You were watching Wisconsin Women, and we are here today at Dreammaker Bath and Kitchen of Madison. We'll be talking with them coming up. Looking forward to that. But first, as you know, taking care of your mental health is so important. It seems to be just increasing issues and anxiety and depression for people. So we want to make sure that we're hitting that as soon as you're noticing symptoms. Our next guest can help you. Relief Mental Health is here. Susan Mueller, welcome. Thank you so much for coming on.
Thank you for having me.
Oh, absolutely. So you're new to the Madison area. You just opened a clinic here in Middleton. So can we kind of just start with maybe what services Relief Mental Health offers?
Sure. We're a pretty comprehensive mental health outpatient service provider. So we do things as simple and easy as managing medication, psychiatric medication, to therapy. And then we do some more intense, innovative treatments called transcranial magnetic stimulation and SPRAVATO. Those are mostly for treatment-resistant depression and OCD, so more acute mental health conditions as well.
Okay, let's dive into the TMS a little bit, and who can benefit from that, and how many sessions is that?
Yeah, TMS is it's a treatment for treatment-resistant depression, so patients that have tried things like medications and therapy, and those just really aren't sticking for them. It's non-invasive. It's done in our office. We use a machine that has 20-minute treatments. You come daily for 6 weeks. And it's very helpful and it's very durable. It also treats OCD. So patients that have treatment-resistant OCD, they've tried other things and they're looking just for something different that they haven't tried in the past. It's very helpful. Right now, it was just FDA approved for people 15 plus. Typically, we treat patients that are 18 and older, but we may be able to treat a younger patient as well. So, if there is a possibility that somebody younger is looking for that treatment, we can definitely look into that.
I'm wondering, is there any kind of side effects that people can experience after having a treatment?
The great thing about TMS is that it has no systemic side effects. So it is, patients might experience a little slight headache or maybe just a little bit of soreness where we are applying the treatment just in the first couple of days, but those are usually very easily fixed with just some Advil or a painkiller. But that's the nice part about it, because unlike medication, you're not going to have any of those really tough side effects that you experience with your typical antidepressant.
Nice. And you mentioned SPRAVATO. Is that how you say it?
Yes.
Can you tell us a little bit about that then too?
SPRAVATO is it is an antidepressant, so it's a fast-acting antidepressant. It is an intranasal esketamine. So it's a spray that goes in your nasal cavity, kind of like an allergy spray. And patients come to do that in our office. They're monitored for 2 hours. We monitor all of their physical
kind of reactions,
and make sure that they're okay. And then we send them home, but they come to us a couple of times a week to start, and then they come about once a week. But it's very, very effective for treatment-resistant depression. And it's very fast-acting, so we see results from SPRAVATO very quickly.
Oh, that's great. Yeah. It kind of brings to mind then about cost, because we all know that healthcare can be so expensive. Is this something that's typically covered by insurance, or how does that work?
Yes, so that's the greatest thing about all the treatments that we do. Everything that we do is FDA approved, and it is covered by insurance. So obviously there are everybody's insurance plan is going to be a little bit different, but it is going to be covered by insurance, and we are in network with all major insurance providers, so any sort of PPO, and also Medicare. So it is covered by private commercial insurance and Medicare. So it's very nice that patients can use their insurance.
Nice.
And we have a less than a minute left, but I just kind of want to see what kind of you think sets Relief apart from other places to go. What makes you guys a little bit different?
Relief is a I don't want to say it's a one-stop shop because it's such a silly term, but it kind of is. So, I mean, you can come and you can do your medication management, you can do therapy, you can do TMS, you can do SPRAVATO. So it's all under one roof. You can have all your mental health providers at one place. We've really made a commitment to our patients to get people in quickly. One of the things that we always say is that mental health doesn't wait. So we try to get people in within 24 hours. At the very most, we'll look at maybe a week to get patients in. So we really like to see people quickly and make sure that they understand everything about what's going to happen. We give them kind of a rundown of what their out-of-pocket will be, all of those things. We try to make it very easy.
That's so nice. Yeah, you're making it easy. You're getting them in quickly.
Yeah.
So glad you could come on today.
Yeah,
Thank you so much.
Appreciate it.
For Wisconsin Women, I'm Stacey Hansen with Lee Aker. We'll be right back.